we've already gotten some fabulous questions, so I wanted to respond to some of those right away, and then if we have additional time, we'll definitely take more questions. So is this webinar good for CE requirements? We do not have CEs associated with this program specifically, but in some cases, national associations or states may accept the information about the webinar and the length of time that you participated and call that a continuing education credit. So I would recommend that if you want to do that, follow up with the folks in your state or with your organization and let them know that you participated in this webinar. I got a question about resources for needle exchange programs, specifically in Northern Ohio. Wanted to let you know, I wasn't exactly sure what resources you were talking about, but wanted to give credit to the CDC, which has a resource page for syringe services programs that may be helpful in terms of information and connecting to other resources. We also have the North American Syringe Exchange Network at NASEN, NASEN.org. They have information about where needle exchanges are located. We did get a question about available federal funding, if the resources that you were asking about were related to funding. And I wanted also to just make sure that people know that CDC, HRSA, and SAMHSA can make existing federal funding available to use for certain components of syringe exchange programs. There is a process, and CDC is been very quick in responding when states or local jurisdictions make the request to use those funds that they're receiving for syringe services programs when the state or jurisdiction has demonstrated the need. So CDC's website has the information about how to apply to use existing federal funding. At this time, I am not aware of new funds that are available from the federal government. One person asked about the resource that Dr. Merman mentioned in terms of the guidance on HIV and viral hepatitis outbreaks for among people who use drugs. They asked specifically if that guidance will address STDs like syphilis among people who are injecting methamphetamine. Dr. Merman was able to share that the guidelines for outbreaks, do not directly address syphilis, although it supports linkage to STD clinics and medical services. However, CDC does already have an existing comprehensive health guideline for people who inject drugs, which is available on the website, generally speaking, not in the context of an outbreak. So one other question that we got that I thought was really great, for people who are working in MAT or methadone programs, they're asking if generally MAT programs are testing for HIV, hepatitis B, hepatitis C as part of their physical exam. And I would say that from the research, it appears that many MAT programs are not testing. That's a dynamic that we believe should change over time, and we have seen an increase in the proportion of methadone programs that are testing for those infectious diseases. But I would encourage people to think about how either from a methadone program perspective, they could add testing or add a referral to those testing services, or from an external person, like I think the PCC clinic person mentioned that they also collaborate with methadone programs in the neighborhood. So there are a lot of opportunities to get folks referred to testing and then into health services, short of expanding programs to do everything, because we know sometimes it's a challenge to do everything well, and we want to make sure that we're getting people to the right services in the right places. I want to acknowledge that it is 4:29, and all of you who've been with us for the hour and a half have really been patient and great. Really want to appreciate all of the work that's going on in the field that we haven't had a chance to showcase. And if you could go to the next slide, please. Wanted to bring up, first off, that we are doing an evaluation of today's webinars, and we really do use that information to improve the work that we're doing and the future webinars that we're planning. And we are planning future webinars. Next slide, please. And then finally, next Monday, March 12th, and Tuesday, the 13th, the National Academies of Sciences, Engineering, and Medicine are doing an infectious disease considerations with response to the opioid epidemic. Rich Walitsky mentioned it earlier, but there is still time to register for that webcast. There may still be space in the room if you're in the D.C. area, and we're excited because we'll be featuring opening remarks by the new Assistant Secretary for Health, Dr. Brett Giroir. So with that, I think we're out of time. Are we out of slides too? All right. So thank you all so much for your time today.
Thank you so much, everybody. It's great to see these examples of good thinking, good work on the ground, and we look forward to continuing our partnership with you to fighting these epidemics. So thank you.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.